coming bright and early this morning. Thank you, Dr. Nova, for that lengthy introduction as well. I'd like to thank Dr. Salcadis for this wonderful opportunity to be with you all today, and thank our colleagues at SEARCA for this chance to be able to talk about communicating One Health in food and agriculture. After that lengthy introduction, I think I'd like to let you into a little bit more detail. I'm from San Pablo City and an alumnus of this university. My passion for further learning started here, and that led me to pursue graduate studies at the University of Newcastle in New South Wales. So, and that also gave me further opportunities to pursue advanced postgraduate training in Murdoch University, Western Australia, which allowed me to formally define animal health communication. That endeavor was supported by the Australian Biosecurity Cooperative Research Centre. I think I was one of the first non-vets in the vet school in Murdoch University. And so for today, I'll be talking about communicating One Health in food and agriculture, or what we can brand as One Health communication. So some of the topics that I'll be discussing today will include One Health, and about the team, ECTAD, and communicating for development, and One Health communication itself. I hope that most of you will be able to take away a few lessons about the challenges and lessons themselves to developing communication programs in a multi-sectoral, multidisciplinary environment. We are in a changing world, so from increasing deforestation to increased demand for wild meat consumption, modernized technology, and increasing human health. So basically, we could all agree that it is a dynamically and rapidly changing world. In this ever-changing world, one of the biggest issues affecting us are health issues. The most damaging epidemics and pandemics of recent decades have had an animal source. These include influenza, SARS, Ebola, and MERS. Diseases that jump from animals to humans, or zoonotic diseases as they are called, are on the rise and can spread in a matter of hours or even days. Adding to this complicated issue of zoonotic diseases is the fact that half of the 900 million people living below poverty level depend on livestock. So basically, if you address anything on animal health, this would directly affect the poorest of the poor. Just to give you a simple overview of how much these infectious disease outbreaks cost the global economy. H1N1, which is endemic in pigs and birds, continue to wreak havoc to the global economy. The latest estimates put the cost at $45 to $55 billion, while SARS, on one hand, cost China, Hong Kong, Singapore, and Canada alone about $30 to $50 billion to address. And Ebola, most recently, just cost the world about $31 to $33 billion in disease management costs. The World Organization for Animal Health, or OIE, estimates that every dollar invested in preparedness saves about $5 in response to an animal disease outbreak. So it is worth our money to invest in any disease response preparedness. So containing animal diseases at source definitely saves lives, protects livelihoods, and reduces animal costs. So the risk continues to increase as we take a number of issues. First one is zoonosis. In the increasing threat of possible bioterrorism that could originate from animals is a fact that even the U.S. takes seriously, because some of our funding comes from the Department of National Defense, the Department of Defense from the U.S., or DETRA as well. And then there's the increasing animal protein demand that almost threatens our food security. And most recently, FAO released its report that biodiversity is sort of getting smaller. The need for a better understanding of the relationship between biodiversity, ecosystems, and infectious diseases. And then the economy is constantly under threat from animal disease that would directly affect the poorest of the poor. So basically, the overall message is risk continues to increase day by day, even regardless whatever we do in our present time. Most of the reported diseases in the region are rabies, leptospirosis, and anthrax. This is from 2015. And these diseases are so complicated to deal with that we need really a multi-sectoral and multidisciplinary approach. This is where One Health approach comes in. FAO's working operational definition is it is an integral approach that calls for increased multidisciplinary and intersectoral cooperation, capacity development, and communication to address various issues regarding the different interfaces. Other technical areas that would contribute to One Health include food security, sustainable nutrition, food safety, ecosystems, trade, and food standard settings. One Health has only been formalized since 2008 among the tripartite, as we know, between FAO, World Organization for Animal Health, or OIE, and the World Health Organization. It has been strengthened last year. A recent tripartite MOU has just been signed. And the One Health approach requires shared commitment. The FAO and the WHO tripartite applies One Health approach by combining their respective expertise to reduce risk to health and human-animal ecosystems interface. Most recently, last year, the United Nations Environmental Program has started formalizing their partnership with the tripartite. And this is good news because we are truly entering a truly One Health phase in the our quest to manage animal diseases, environmental, environmental and public health. So the recent MOU between the tripartite, the WHO, FAO, and OIE led to stronger commitment to strengthen strategies, increase activities on influenza, rabies, and AMR. So there's more money coming in for influenza, rabies, and AMR, hopefully. But at the moment in Asia, there are only a total of 20 countries that have national One Health platforms. In Southeast Asia, Cambodia, Indonesia, Laos, Malaysia, Myanmar, Philippines, Thailand, and Vietnam are the countries that have a functioning One Health platform. 16 countries are with legal recognition of a multi-sectoral, multidisciplinary platform, and 18 countries have coordination meetings on a regular basis. As mentioned earlier, I am a member of the Emergency Center for Transboundary Diseases. This is the corporate arm of FAO to deal with disease emergencies and deliver capacity building assistance. So our motto is protecting people and animals from disease threats. We have four global offices. The main one in Rome, Italy, and we have 2 regional offices in Africa, and one in Asia and Pacific is based in Bangkok, Thailand, where I am. So what is the role of communication in development? As we know, I'm very proud that I'm from here, so DEFCON emanated from this university, and other approaches have come up, and we now have communications for development, behavior change communication, animal health communication, and health communication. The one that I forwarded when I did my PhD was I extended the definition of health communication, and we refer to it as the study and use of communication strategies to inform, influence individual and communities' decision to enhance animal health or prevent, control, and eradicate animal diseases. Overall, communication is key to making project deliverables easier in a way, but it's not like the only key. But it helps in the project identification and formulation. It assists in making sure all the project deliverables are implemented and then accountability is sorted. Following are some of the key activities that we are pursuing at the region and addressing transboundary animal diseases. So we are pursuing improving understanding, knowledge of the disease characteristics of newly emerging zoonoses. So we do this by promoting or even assisting countries in their surveillance, such as AI, H7N9, H5N1, and H9N2. And we have conducted regional workshops as well. And then we are also capable of giving technical assistance in risk management in various interfaces. Most recently, we conducted simulation exercises and outbreak simulation exercises and live bird market. These simulation exercises, I'm glad to say, are very much supported. If this happens, we are able to implement emergency protocols, and we have readily materials and all the goods from PPE to vaccines are nearby and could be delivered in 3 to 5 days. And one of our flagship programs is developing the veterinary epidemiology capacity in the region. So implementing, promoting One Health coordination mechanism. And then FAO as well. AMR actually underlines the One Health approach because it underscores the critical importance of a collaboration between public health and animal health, including the environmental sector. So we have what we call a joint risk assessment exercise or joint risk evaluation, and some of the countries receive this through WHO leads the evaluation, and then there's a multidisciplinary team that visits the country and evaluate them regarding their risk readiness. So we continue to engage regional frameworks as well, available to enhance regional collaborations in One Health. And this includes the ASEAN, Pacific countries, and South Asia. So we also continue to promote multi-sectoral collaboration through regular tripartite meetings at the regional level. And I'm glad to say that the collaboration at the regional level is very much strong among WHO, FAO, and OIE. And this is the ECTAD Asia team composed of mainly veterinarians, and the rest are animal health economists, M&E specialists, operations specialists, and I'm the known DevCom specialist in the team. But although I play a big part as well because I support a number of countries, including 11 country teams in Southeast Asia. One Health communication is the convergence of various approaches to communicate and address various issues regarding animal, plant, and human health, with relevant environmental issues that calls for increased multidisciplinary and interpersonal cooperation, capacity development, and communication. So this is my sort of framework in terms of what One Health communication really is. It is a convergence between animal health communication, public health communication, environmental communication, and agricultural communication. So these approaches feeds into the One Health communication. It is very complicated, but then it is just it is really a matter of balancing act. Some of the basic tenet is DevCom or FAO's communication for development, with the main aim of improving one's personal welfare or promoting positive behavior change towards healthier individual, safe food, and better environment. So some of the approaches that I'm sort of playing around include risk communication, and if you've heard of the nudge theory and the planned behavior theory. I've been talking about AMR as well. One of the issues that really highlight One Health approach, as I said earlier, is AMR. This is the FAO action plan. And as you can see, focus area number 1 and number 4 mainly is related to communication and advocacy. Number 1 is improving awareness on AMR, and then number 4 is promoting good practices. Some of the activities that we've done at the regional level, including collaboration with WIPRO, WHO's office in the Western Pacific and then Southeast Asia, and OIE and Asian Pacific, and FAO is through the ECTAD collaborated World Antibiotic Awareness Week celebrations. So around the region every November, second week of November, we have this country-wide global campaign to raise awareness on antimicrobials such as antibiotics. As you can see in this sort of stakeholder map or list, our stakeholders is pretty wide-ranging, from the general public to even the elderly. You can go specific to children. The variety of stakeholders that this issue affects warrants a careful and well-coordinated approach in the campaign to mitigate AMR spread. At the food and agriculture sector, our key stakeholders include farmers, veterinary pharmacists, animal feed and vendors, animal health workers, and veterinarians. So I'm glad that I was able to forward this, help develop the ASEAN regional strategy on antimicrobial resistance, communication, and advocacy. The ASEAN is on board and has endorsed this AMR communication strategy, and the main aim is promoting prudent use of antimicrobials such as antibiotics and encouraging good animal husbandry practices. All of the countries are moving forward, and through the One Health platform, they're able to do these campaigns aside from AMR, including rabies and other animal disease issues. The regional tripartite has coordinated or collaborated to implement a number of activities, including but not limited to CAP+. CAP+ is a novel approach that we are trying to promote at the moment. This is just assessment of knowledge, attitudes, and practices on of stakeholders on antimicrobial resistance and antimicrobial use. We have also developed a number of a regional toolkit which is ready for countries to use, production of template communication products which is available online, and the coordinated approach on World Antibiotic Awareness Week celebrations. Content creation for social media are also ready to go for countries to dispatch. While social media is mainly aimed at donors and high-level policymakers, it has been instrumental in our campaign in this age of fake news. Rabies might seem as mainly public health concern, but FAO has supported a number of rabies vaccination campaigns around the region. One of the justifications that for this is that if rabies is not eradicated, the threat to livestock, animals being accidentally bitten and intentionally infected by rabies is so great and not to be ignored, because farmers are depending on livestock. Regional activities to rabies campaign is similar to what we are doing in other zoonotic diseases, including AMR. We have regular tripartite meetings that were keys to successful implementation of region-wide activities. In fact, in April, we have a high-level tripartite zoonosis meeting happening in Bangkok, wherein all of the stakeholders gather to review strategies that have been implemented in the region. And this is where we sort of sit down and think about what we did, how are we doing, and how do we move forward. And also, I think I do believe that most of you are familiar with world real estate. I've only scratched the surface. I can go on and talk for a few more minutes or even hours about case studies on One Health collaboration, One Health communication. But I would like to go into talking about the practical challenges that we've encountered implementing a One Health approach and communicating it to key stakeholders. So the challenges as well as opportunities are themselves the multi-sectoral and interdisciplinary nature of teams and stakeholders. Because having a multi-sectoral and multidisciplinary team of stakeholders is at the very least is a big headache just to collaborate, gathering these people around. In our own experience in the F&B campaign here in the Philippines, we've had a hard time trying to reach out to the private sector, and our project implementer, which is FAO, is sort of they should have somehow their partnership with the private is a little bit their hands are tied to really engage with the private sector. So it is the Bureau of Animal Industry that has to reach out really without compromising public concern. So in our team as well, multidisciplinary team, it's a very big task to even consolidate ideas, because there's a lot of great ideas in one room sometimes on one issue. But then which one do you prioritize to move forward to achieve our goal? And also an age-old problem is the gap between awareness and practice. So sometimes people would be, easy problem would be raise awareness on this. But then you come down to the field and you become aware that they're well aware of the problem. But then their practices, it doesn't add up with what they're doing. They continue to do the risky behavior. Why? Because it's their way of living. They've been used to it. And the thing is, if they don't do this, they won't eat. So what do? And there's a lot of evidence-based interventions, especially in One Health communication. So most of the projects, they come down to the field, come up with various communication campaigns, a la PR agency in the field, coming up with a shotgun approach into public awareness and not having a good idea as to where it would lead. So this is why we've introduced the CAPLAS, and we're hoping that every step that we make is guided by evidence. So, and then another challenge in One Health is the issues actually affects people, of course. The issues affect people. And so the emphasis on public health sector is heavier at the cost of downplaying the risk at the other health sectors. So basically, when you go out in the field, sometimes you can't help but include the general public in your campaigns. So, which is sometimes not too good in terms of, for us at FAO, we are trying to align our campaigns to contribute to our organizational goal of zero hunger. So better and strong government policies would support better disease outbreak management. So these are some of the considerations when you're thinking about One Health communication in food and agriculture. So there needs to be a strong government policy supporting the One Health platform. And then if there's a political will, then I think everything will follow. From then the trust issues among stakeholders would increase. It doesn't. This is what we've noticed, because even regardless of what kind of government there is, I mean, in Vietnam and Cambodia, Laos, socialist countries, communist countries, but the One Health platform, while not perfect, is working for their own benefit. So, as I said, strong government policy, trust among stakeholders, and sustained collaboration. No matter how bad or cliche it might look, but regular meetings with key partners, regardless if there seems to be any progress or not, it is key to stronger collaboration and continued sustainability. For my last slide, it pays to involve as much stakeholders as you can in planning workshop, regular meetings or briefings. It's better to have everyone on board, because somehow along the way it will taper off. You'll have some stakeholders being sidetracked with a lot of other issues. And one of the things that I've also learned along the way is about stories. Why do you think emotional ads are instant hits as viral sensations? Anyone here have any idea as to why is that? Jollibee stories. Ano pa ba? What McDo is following suit, and I can't recall anything about Philippines, but then Thailand has one of the best ads as well, from very funny to tear-jerking commercials. But then after that, you go to the drugstore and then buy that product. You don't know why. The thing is, one of the recent approaches introduced that has potential in development context is Gaston Legorboro and Darren McCall's storyscaping approach. It is basically an approach towards nudging your audience towards your intended behavior. McCall said that the stories can create a bond and then drive that behavior that we want. So once they're glued, then it will follow. They will sort of somehow fall into the trap of buying your product or even agreeing to your opinion, regardless if it's true or not. But of course, we're all in science-based and truth only here. Having a single compelling story to tell will glue your stakeholders to your cause. The Bible, for one, is a classic example for this. A book with a single storyline, despite having small books written by a dozen of writers from different cultures over a span of 1,500 years. It's the only book in history that tells a single story, a consistent plot about God's love story. I'm not here to preach, but having pointed out the Bible, the Bible, don't be afraid to discuss things out of the box or even repurposing old materials, as long as it contributes to your stronger case towards positive outcome. Use anything at your disposal, including social media. In the end, One Health approach can still be considered young, and One Health communication is still a dynamic approach and will be defined in more detail in the future as its theory and practice are continually tested in the field and in our profession. It is complicated. As we learn and relearn, we will be able to achieve a healthier population, safer food, healthier livestock, and better environment. With that, thank you very much.